Hi there, this is Nursing Education Videos. Today I will be reading Hyperkalemia, Mnemonics, NCLEX review on registerednursern.com. All credit for this information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. Disclaimer from registerednursern.com. This video is for educational purposes only and it is not intended as medical advice. While we strive for 100% accuracy, errors may occur and medications or protocols may change over time. Hyperkalemia, Mnemonics, NCLEX review notes. Studying for hyperkalemia. Want to know how to remember hyperkalemia and how it is different from hypokalemia? In this article, I want to give you some super easy ways on how to remember the causes of hyperkalemia, signs and symptoms, and the nursing interventions for this condition. I want to highlight the material you will be tested on in lecture class or the NCLEX exam. After you read these notes, be sure to take the quiz on hypokalemia and hyperkalemia. You will learn the following: the causes of hyperkalemia, easy mnemonics to remember it, signs and symptoms, so on how to remember it easily, nursing intervention, things that NCLEX and lecture exams look for. Hyper equals excessive, cal equal root word for potassium, emia equals blood. Meaning of hyperkalemia is excessive potassium in the blood. Normal potassium is 3.5 to 5.1 millimole per liter. Anything higher than 7.0 is very dangerous. Most of the body's potassium is found in the intracellular part of the cell compared to the extracellular, which is where sodium is mainly found. Blood tests that measure potassium levels are measuring the potassium outside of the cell in the extracellular fluid. Remember that potassium is responsible for nerve impulse conduction and muscle contraction. Causes of hyperkalemia. The mnemonic or the phrase is the body cared too much about potassium. The mnemonic is cared, C-A-R-E-D. C for cellular movement of potassium from intracellular to extracellular, so burns, tissue damages, acidosis. A for adrenal insufficiency with Addison's disease. R for renal failure. E for excessive potassium intake. D for drugs, potassium-sparing drugs such as spironolactone, triamterene, ACE inhibitors, and NSAIDs, so non-steroidal anti-inflammatory drugs, NSAIDs. So non-steroidal anti-inflammatory drugs. Signs and symptoms of hyperkalemia. Remember the word or the mnemonic murder. M for muscle weakness. U for urine production, little or none. Renal failure. R for respiratory failure due to the decreased ability to use breathing muscles or seizures develop. D equals decreased cardiac contractility, weak pulse, low blood pressure. E for early signs of muscle twitches / cramps, late profound weakness, flaccid. R for rhythm changes, tall peaked T waves, flat P waves, winded QRS, and prolonged PR intervals. Nursing interventions for hyperkalemia is monitor cardiac, respiratory, neuromuscular, renal, and GI status. Stop intravenous potassium if running, and hold any PO potassium supplements, which is per oral. Initiate potassium-restricted diet, and remember foods that are high in potassium. Remember the word potassium for rich food in potassium. So the mnemonic potassium. P for potatoes, pork. O for oranges. T for tomatoes. A for avocados. S for strawberries. S for spinach. I for fish. So U for mushrooms. M for musk melons, like cantaloupe. Also included are carrots, cantaloupe, raisins, bananas. Prepare patients for dialysis if necessary for hyperkalemia. Most patients are renal patients who get dialysis regularly and will have high potassium. K-exalate is sometimes ordered and given PO or via enema. This drug promotes GI sodium absorption, which causes potassium excretion. Doctor may order potassium wasting drugs like Lasix or hydrochlorothiazide. Administer a hypertonic solution of glucose and regular insulin to pull the potassium into the cell. Don't forget to take the hyperkalemia quiz. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button and go to registerednursern.com for more information. I hope everyone has a good day.